Alright guys, let's talk about the appropriate steps that you need to take when performing tracheostomy care on NCLEX. This can show up as a drag and drop or also a select all that apply. So the acronym that I was able to come up with the steps in order for tracheostomy care is called SPA raids. If you can think of something better, let me know, but let's run through it. Step 1 is supplies and semi-fowlers. So we're going to gather everything at the bedside so we have it accessible, and we're going to place the patient in semi-fowlers if it is not contraindicated. Next is personal protective equipment. So this includes masks, goggles, and clean gloves at this time, okay? It's important to remember masks and goggles because if that patient expectorates some sort of sputum while you're performing tracheostomy care, you want to protect yourself. A in SPA stands for auscultate lungs. If you hear secretions, then you want to suction before moving forward with tracheostomy care. And why is this so important is because aspiration is a huge risk during tracheostomy care. So we want to eliminate that and make sure we can do everything possible to prevent it. R stands for remove soiled dressing. So if you see that picture above, you have that white split cotton dressing that goes under your trach ties. So you want to remove that with your clean gloves. Now when you remove that soiled dressing, you're going to throw your clean gloves out with it, okay? And then for A in rage, you're going to apply sterile gloves to remove the inner cannula, okay? After we remove the inner cannula, we are going to insert the new inner cannula. Next, we're going to be drying and cleaning the stoma or the area around the trach. It's really important to remember that you're not removing the trach ties for this. So you're just switching out the inner cannula so you just clean as you can. And lastly, once that's done, we're going to put sterile gauze under the trach. So that soiled gauze that we removed, we're going to put new sterile gauze under. And then this last little note here, once everything is set, make sure one finger fits under the trach ties because we want to ensure that airway is intact and there's no opportunity for lost airway or that those ties are too tight. All right? Hope you learned something from this. Follow for more.